Kirsten, hello, how are you?
I'm okay.
I looked at Ginny's x-ray and CT scan images, and unfortunately she does have craniosynostosis as we thought. The images show that the suture has fused early.
Okay.
Baby skulls have openings called sutures, which allow the brain to grow. In the first year, the brain triples in size, and after that, continues to grow until, she's about 12. Can you tell me a little bit more about her symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Oh, I'm sorry to hear that. Ginny has the condition craniosynostosis, but her skull shape is almost normal, so that probably made it a lot more difficult to diagnose. Craniosynostosis is uncommon. So many doctors have difficulty, detecting cases like Ginny. Just to explain a little more to you, when Ginny's brain is growing, it needs to be able to push the skull bones apart in order to give it room for it to grow. And if there's a fusion of the suture, then the growth is restricted and the brain is squeezed. It's intracranial pressure is what we call it, and it can be extremely painful. I'm impressed at how brave she is. She's a strong child.
Yes, that's true. She is. So, what are the options?
Well, my biggest concern is reducing the intracranial pressure. We can do that with surgery.
Surgery? That sounds really dangerous. My pediatrician thinks it can be fixed with a helmet.
If the sagittal suture hadn't fused already, then a molding helmet might work, but not now. Every surgery has several risks, especially head surgery. So, at least Ginny is healthy otherwise, so that greatly reduces many of the risks. We'll double check to make sure she doesn't have any kind of heart or lung conditions, which may represent a contraindication to surgical treatment.
I'm just really concerned. What exactly will this surgery involve?
Well, you got 2 options. She's only 6 months old, so we can do either a minimally invasive procedure or we can go with the traditional surgery. I'll explain the difference between the two. The traditional approach involves putting a little incision at one ear, going across the top of the head to the other ear. It's usually the only scar. It's normally hidden by the hair. Once the incision is made, we remove the affected areas of the skull. We create an opening for the brain to grow. We reshape the bones, replace them in a normal position, and after we're finished, the incision is usually closed using dissolving sutures.
This sounds really difficult.
It is. I'm not going to lie to you. It's a big surgery, and it can last up to 8 hours. Craniosynostosis is complex. It involves the expertise of a number of different surgeons, specialists actually, working together. Afterwards, Jane would have to spend about 3 days in the hospital.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the surgery would be completely successful in terms of removing the condition entirely. In some cases, the children might have a little bit of pain. We usually control that with medication. In some rare cases, there's a need for a second surgery, but that's, like I said, that's very rare because the success rate is very high. It's over 98%, and we've been doing this many years very successfully. So.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
Well, no worries. You're free to ask all the questions you want. With the second minimally invasive procedure, it's Well, it's endoscopic, and it's usually performed on the baby when they're very young, typically younger than 6 months. We use an endoscope to open the suture. It only lasts an hour. She only has to spend a night in the hospital, and after that, she can usually go home the next day. She has to wear a helmet, a molding helmet after that for about 6 months, but we have to check it every 3 months to make sure the sutures don't close early. It's a simpler procedure that can be equally successful, especially when the baby's young. So.
Okay. Is the helmet painful?
No, don't worry. Helmet's not painful. It's custom made. Success of the procedure depends on how consistently the helmet is worn. Actually, after about 6 months, we know whether the growth is normal. If it's not, then we have to perform another surgery, possibly. The second surgery would be the traditional longer one. Once we perform that second traditional longer one, it would also involve working with a team. Our team includes a plastic surgeon and neurologists.
This is all overwhelming. How do I decide what's best for Jenny?
I know it's overwhelming. There's a lot to consider.
You're pretty sure she needs surgery. A helmet alone won't work.
No, unfortunately. There's been a fusion, and it has to be corrected surgically. Plus, if you wait a month, then the simpler procedure won't be an option because it'll be too old for that. We typically perform endoscopies on 2 to 3 month old babies. So, what I recommend is that you talk to some other specialists in the field, because the more information you have, the better off you'll be.
Okay.
I'll have my assistant print a list of the contact details of my colleagues and
Thank you.
get that to you.
This is very stressful.
Oh. Yeah, I understand. I'm sure it's stressful and exhausting. Any family or friends you can help you out?
My mom.
It's good that you have your mom to talk to and give you some support. So, any other questions I can answer for you, or?
No, this is all really helpful.
Okay, I know it's a lot of information. Let me give you a brochure that has information about craniosynostosis on it, and you got your treatment options there. So,
thank you.
if you have any other questions, again, please feel free to let me know. We'll have a second appointment to discuss it.